Hi, it's Rogel again on hip surgery recovery. Anyway, today I want to talk about what happens before you go into the hospital, before you get the surgery. I didn't have a lot of choice because I had an accident and I went in as an emergency and I got what I got, the doctor that was on duty. Fortunately for me, I was in Vail. He was from Stedman. It was Dr. Millett. He's the surgeon for the Olympic ski team. He was fabulous. But, you know, if you have an opportunity to interview your doctors, interview them. Find somebody fabulous. Find somebody fabulous. If you're in Vail, Dr. Millett. If you're in the Bay Area, Bill McGann. They're fabulous surgeons. If you're in a different area, ask around. Talk to people these doctors operated on. You know, we're getting a pool fence and we're calling people that the companies have taken care of to make sure that they're reputable, that they do a good job. I mean, this is your body. Take your time. Get the best doctor. And when you get the doctor, when you decide on the doctor, make sure you ask them questions that are important to you. How long the recovery is going to be. Now, before surgery, they have to tell you all the horrible things that could happen. You can die in surgery. You can die after surgery from complications. You can get an infection. You might have to have blood transfusions. One leg could be longer than the other, or shorter. But the legs could come out different lengths. Oh my God. The scar could be really bad. Well, and they tell you so many things. I remember I was laying on that table and they had to go in and tell me all these horrendous things that could happen. They have to tell you that. Stay calm. Most of these things do not happen, okay? So, but talk to the doctor. Tell him to make sure they concentrate, get the legs the same length. You know, I told my surgeon, I said, I have to have my legs the same length. I dance. I have to have them the same length. And as far as the scar, you don't want a horrible scar. You don't want staples. Get a plastic surgery closed. I mean, my scar is so minimal. It's like it's going to fade within a year. Get a plastic surgery closed. Talk to your physician about that. What else? Visualize. And visualize for the doctor. Tell the doctor before you go into surgery, so you're going to do a great job and the hip's going to turn out fabulous and my legs are going to be the same length and my scar is going to be minimal and I'm going to feel and look great and everything's going to work out perfectly. You have to see it for yourself. You have to see it for your doctor. Make sure that you do your visualizations before. It's really important. They told me that it would probably be 2 to 3 months on crutches before I was able to walk without crutches. 2 to 3 months? I said, there's no way I can be on crutches for 2 to 3 months. No, 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 no. And I visualized. I said, no, within 2 weeks, I'm going to be off those crutches. 2 weeks, max, 2 weeks. And the doctor's looking at me and he's shaking his head. I don't think so. Well, maybe, you know. I said, no, 2 weeks, that's it. 2 weeks. 10 days they did an x-ray and they said, you're doing great. You could start walking without your crutches. You have to visualize it. If you visualize it, you'll create it. Okay? So hang in there. If you're doing an elective surgery, get all your ducks in a row before you do this. You know, take your time, get the right doctor, do your visualizations, create what you want. And the type of surgery and recovery that you want. You have the power.